Hi, it's Jennifer again here at Indiana State University studying for my BSN. And today's lecture is about sleep apnea. There are a lot of people at risk for sleep apnea, a lot of people that have sleep apnea and they don't even know it. So let's learn a little bit about this today. Please check out the pre and the post test. There's a link at the bottom for those. And there's also another little handout that has some information on it. So what is sleep apnea exactly? It doesn't allow the body to enter into a restful sleep. And this greatly increases the risk of transportation accidents because when a body doesn't get restful sleep, they have extreme fatigue, mental fogginess, confusion, and their physical agility is affected. And if you look at the picture of the truck driver, we want his physical agility to be unaffected. So it's very important for truck drivers, bus drivers, people like that to definitely get checked for sleep apnea. There are two kinds. There's obstructive and central. Obstructive sleep apnea, that's where the anatomy of the mouth and throat relax and then obstruct and air can't get in and out the way it's supposed to. Central sleep apnea is where the signals are disrupted between the brain and the diaphragm or the breathing muscles. Both of these cause hypoventilation, and that's a fancy word meaning that you don't breathe deep enough or sometimes enough. So the body senses the lack of breathing and it will cause an awakening. Some people don't even know that their body awakens because it's so subtle, and that other people do understand that their body has been awakened, but they're not sure why. So if sleep apnea is not treated, it can lead to high blood pressure, heart failure, stroke, brain damage, and sudden death. The risk factors for sleep apnea, the main one is obesity, because especially if you have a lot of extra fat around the neck, that creates more obstruction. So obesity, smoking, or if you have some chronic lung conditions already, such as asthma or COPD, or if you have chronic nasal congestion or a deviated septum. And here's a funny one, menopause. Who would have thought that menopause might bring about sleep apnea? But studies have shown that it does. So menopausal women really should get screened for sleep apnea. And for some reason, African Americans tend to have more episodes of sleep apnea. So signs and symptoms are fatigue, and this is regardless of how many hours of sleep you've gotten. Trouble concentrating, trouble staying awake, or if you're a little bit irritable or have mood changes. But here's a really important one, awaking several times through the night and to get up to use the bathroom. Now, some people may have some bladder issues, but it has been studied that a lot of times sleep apnea wakes the person up, so the person thinks that, okay, I have to get up and use the bathroom, when actually it was the sleep apnea that woke them up. And snoring is also a sign of sleep apnea. So the sleep study, this is what they do to screen if you have sleep apnea. It's very interesting because you can learn a lot about yourself. You can learn if you're a nose breather or a mouth breather, whether or not your legs move like restless leg syndrome, and they can also tell how deep you breathe and if you're dreaming. Now they can't tell you what you're dreaming, they can't read your mind, but they can tell whether or not you're dreaming. And there's also a microphone that records snoring and how deep you can sleep. They can measure that as well, what stage of sleep you're in. And it also measures the oxygen that flows in your blood to make sure you're not getting too low on that. And it can tell you if you stop breathing. So what's the treatment? The first treatment is what they call position dependent, meaning that you don't sleep on your back. Because a lot of people with obstructive sleep apnea tend to have more obstructive episodes when they sleep on their back, simply because the throat muscles and everything relaxes and closes in on itself. So this is the first line of treatment, is to not sleep on your back. Second line of treatment is the CPAP or the BiPAP. And the CPAP is the continuous positive airway pressure. That means it's just one setting. The BiPAP is a bi-level positive airway pressure, so it's two settings. You've got one for inhalation and one for exhalation. And the air keeps the airways open by pushing the air in. And there's various kinds of masks, full face, nasal pillows. And then there's some that's a combination that they call a hybrid. And finding a good mask is like finding a good pair of jeans. You just gotta watch and shop and see what you think you might like and give it a try. Another way of treatment is through an oral device. This propels the bottom jaw forward, so that helps with the obstructive sleep apnea, and it helps to where the jaw doesn't relax too far back, causing the obstruction. And if you'll notice in the picture, there's a little airway there to get the air in and out. Another treatment is surgery, and it's a big long name. That's why most people call it a UP3. And if you look at the picture, the UP3 surgically removes the uvula, that's the piece of flesh that hangs down, and it also removes all of the soft tissue in the back of the throat, including the tonsils. It's a very painful surgery. There are several benefits to being treated for sleep apnea. You're going to have more control over your blood pressure. A lot of times people who have uncontrolled blood pressure is because they have sleep apnea. And the same holds true for blood sugar. So you're going to have more control if you're treated for your sleep apnea. You're going to be more alert, less fatigued, more energy, and just better overall health. So there's a lot of information out there online to kind of screen yourself to see if you do have sleep apnea. There's different questionnaires and things like that. It's also preferred, especially if you feel like you have a lot of fatigue or wake several times through the night, that you do let your doctor know, so that way your doctor can order screening tests as well. Thank you so much. Have a good day. Bye-bye.